Okay, it is time for your health check. We're hearing a lot about monkeypox as this continues to spread. There are now 4,600 cases nationwide. That's according to the CDC. The risk of contracting monkeypox in the U.S. is still incredibly low, but a lot of you have questions, understandably, and I took them to an infectious disease specialist, Chief Innovation Officer at Boston Children's Hospital, Dr. John Brownstein.
So we have been hearing a lot about monkeypox on the news, in the headlines. First, let's clear up, how do you get monkeypox? Because I think there is some confusion here.
That spread is occurring through mostly close contact. So that's skin to skin, touching. But of course, there is the risk of spread through clothing or respiratory droplets at close range.
How deadly is this? Are people dying from monkeypox?
The good news is that the strain that is circulating right now around the world is not believed to be particularly deadly. Most everyone who is infected survives. The main concern we have is not necessarily about death, but it's about the outcomes, around the symptoms, right? So scarring that occurs from the rash, or the virus spreading into the eyes or cornea. And that's when serious cases can arise.
Where can you get tested if you suspect that you have monkeypox? And what does that testing look like?
Tests are actually usually conducted on the lesions themselves and sent to a laboratory for confirmation. Obviously, you can talk to your primary care physician or provider about accessing a test if you have concerns about symptoms. If you don't have access to a healthcare provider, then of course, call your local public health department. They're building up resources to offer testing to anyone who needs it.
What can the general public do to prevent or avoid monkeypox?
Obviously, if you have symptoms, you isolate, you avoid skin to skin contact, but then it's the basic hygiene: clean hands, wash objects that are used regularly, wear a mask if you're in close contact with someone that might be infected.
My thanks to Dr. John Brownstein for his time. Also for all of you who sent in some really great questions. There is no proven treatment for monkeypox. It usually just goes away on its own. Right now, some doctors are prescribing antivirals that target smallpox. Doctors do recommend rest, fluids, and over-the-counter pain reliever until it just kind of clears itself.
And at this point, as far as vaccines are concerned, you have to have been in close contact with someone to get one?
Yeah, and it also really depends on where you live. I talked to friends from New York to California and then here in Texas, and everyone's having a little bit of a different experience depending on where you live. And I'm sure it's different in other parts of the world as well. But yes, that is the case for people in Texas right now.
Okay.
Good information. Thanks, Sonia.